Hello friends, now we are meeting in a very odd situation. After a long time, we are continuing with our CME program and I am thankful to AFI as well as Ayurveda Network BHU for giving this opportunity again. Now today we are going to speak about musculoskeletal diseases from Ayurvedic point of view, and I will try to share my clinical experience with you as it. Now, musculoskeletal disorders in general are the bread and butter of Ayurvedic practitioners. Most of the patients whom we deal with in our clinical practice belong to this category. And from Ayurvedic point of view, those diseases which are of Madhyama Bhaga Marga, they are actually having a poor prognosis. Sandhi ashrita, marma sandhi samashrita vyadhi, gambiram bahuda kustam marma sandhi samasritam. These are yapya or asadhya. And because they are yapya or asadhya, most of the patients end up in Ayurvedic clinical practice. Another important is, most of these patients, they would have very similar clinical symptoms, and most of the times the common clinical symptom suggested is a joint pain as such. Joint pain, of course, we now use a single word, but from Ayurvedic point of view, it has elaborated the description of symptoms related to the joint with various words, and each of these words have a significant importance. And I would try to categorize those symptoms mentioned in the text under these heads as pain in joints, rigidity, functional abnormality, or structural abnormality. Pain itself is described with the different words like Sandhi Pida, Ruk, Vedana, Shula, and Spotana. From Sanskrit literature point of view, each of these words have their own importance. Pida is just a continuous pain. Ruk is a severe and sort of throbbing pain. Vedana is a odd feeling, just a pain feeling, but may not be very intense pain. Shula is as if being pricked with a pointed instrument. Spotana is as if the joint is getting cracked. Now, most of the times we will come across the patients explaining exactly similar words in the clinical practice. But from the contemporary point of view, we categorize only either acute or chronic pain. But if we have to go for Ayurvedic diagnosis point of view, we need to assess the patients under these heads. We will have to have some specific questions, and most of the times the patients would give you exactly the similar words in their own vocabulary, and we have to correlate that. Or similarly, rigidity is Sandhibandha or Sandhibedha. Functional abnormality, either it could be like Sandhi Muktata, as if the joint has given away, Sandhi Shaithilya, where the joint has become weaker and is not doing the normal functions. Sandhi Vikriya is where the range of movement of the joint is altered, either it is reduced or increased. Vikriya could be Vishesha Kriya, either it could be reduced or increased. Sandhi Daurbalya is where the weight bearing is reduced, capability of weight bearing is reduced. Sandhi structural abnormality could be either Sandhi Vishlesha or Sandhi Shpotana or Sandhi Vyapadana, where the structures could be altered, or it could be a sense of crepitus, that is Sandhi Shishabdaha. So these are some of those selected clinical words which are used as such. From the current point of view, a patient complaining of joint pain may have involvement of any of the structures. Either it could be the muscles, it could be the joint space, or it could be the bone. So of course, any part of the joint could be involved. And it's quite important to make out which area of the joint is involved and which is the real culprit and where we have to treat it. For today's point of view, we will be limiting ourselves to muscles and the tendons. We will have another session over about the bones and the other structures of the joints in the second session. So for the present today, I limit to only the muscles as such. Now when a patient presents with a pain in joint, from the contemporary point of view, the things which you have to consider are trauma, fibromyalgia, neuromuscular disorders, occupational stresses, tumors, renal bone disorders, psychosomatic entities, degenerative diseases, autoimmune diseases, reactionary arthritis, and so on. Depending upon the pathology, they are categorized into different categories. But for the presence of convenience, I will be dealing with the diseases of the muscles, but not very accurately with the limited only to the muscles, a bit peripheral. But in the second session, we will have some discussion about the diseases related to the bones as such. The first of the thing would be Dhatukshaya. Now, Dhatukshaya involving the joints, again, I limit to this dhatus related to the joints. One is Mamsakshaya. Mamsakshaya Visheshena Spig Griva Udara Shushkata Sandhinam Sputanam, where the joint would be having a cracking feeling, and Glanihi Akshnoha Ayasevata. Now, we will be referring to this shloka again later when we discuss about these two issues. Important is Mamsakshaya can present in two components. One, where the joint becomes abnormal and the joint's function becomes abnormal and the joint looks as if it is getting cracked. One, or it could be Akshnoha Ayasaha, the small muscles becoming weaker and their capacity is reduced. We will be referring to this issue again later when we go into further details as such. Then in the Medo Dhatu also there will be a Sandhi Shaitilya. Medo Dhatu Kshaya also there will be a Sandhi Shaitilya. As well as Asti Dhatu Kshaya also there will be a Sandhi Shaitilya as such. So Sandhi Shaitilya could occur in case of involvement of the Mamsa, Medas, Asti as such. For the sake of limiting ourselves to the muscles, first we will try to deal with the one group of diseases which you call as myopathies. Word pati in English, the contemporary literature means disease. In our colloquial language, in our native language, females, they know about that. Pathis are really the diseases. Now, anyway, the issue is from the correct, and that word myopathy is also a very vague disease, or very vague word which suggests about the disease of the muscle. It's not about a single diagnosis. Causes for the myopathy are too many, and to deal with all the conditions also would be almost impractical. So I would be limiting to certain of the common and important conditions which we meet with in our regular clinical practice. And really, from Ayurvedic practice point of view, patients who come to us. Among them, what I have seen in my clinic is, among the major group of myopathies which I treat, the one is statin-induced myopathy. It's a large number of patients are seen. Reason is, the statins are now quite very frequently prescribed. Now, statin-induced myopathy could be, of course, as per the contemporary literature, the incidence of statin-induced myopathy is not very huge as such. But one of the important issues from the contemporary point of view is either there could be a myopathy in statin-induced condition with vitamin D deficiency, and a significant number with the vitamin D deficiency would develop myopathy, and without vitamin D deficiency there will be lesser myopathy. This is what the literature says. And now this is, I think most of the practitioners are aware of this. Most of the patients who present with the symptoms of pain in the joints, they are investigated about the vitamin D, and most of the patients now are being supplied with the vitamin D and calcium. And when the patients do not get sufficient relief, then only they come to Ayurvedic practice as such. Now this myth about vitamin D deficiency and then statin, in my experience, may not be as it's mentioned in the text as such. It's the other way. Anyway, from my point of view, those patients who are treated with vitamin D are along with that statin being prescribed now is quite a huge prescription. Almost every third patient going to a cardiologist is prescribed with statin, and the expected global statin market also is very high. And I think this is one area where the bread and butter of Ayurvedic practitioners would be better, because one or other day the patients have to be, have to come to Ayurvedic practitioner, because statin as such can produce different categories of myopathies, and that symptoms produced due to statin involved are either it could be myalgia, myositis, and rhabdomyolysis. Now, important is the contemporary text, pharmacology text, they identify myositis and rhabdomyolysis in as a clinical complication or adverse effect of the statin. But myalgia, they are not giving due importance. But what I have seen is a huge number of patients, they come with these kind of symptoms who are taking statin for some or other reason. And the characteristic clinical features would be they would have pain in only the thicker muscles, very often in the thigh muscles, weight bearing, thicker muscles. And most of the times it's in the gluteal muscle, pain in the gluteal muscle area. Patients may not be able to make out whether it is in the muscle or in the joint. So often they say that it is either in the hip joint or in the back, low back, very low back area, pain. But they may not be able to localize. As in case of a spinal pathology, the patient would be able to localize the pain to a specific area. But in a patient of myalgia, patient would not be able to localize the pain and there may not be any tenderness. As you ask the patient to bend forwards or backwards, you will feel that the paraspinal muscles go rigid. This is the most common clinical presentation in a patient with the statin-induced pathology. Of course, the other thicker group of muscles also could be involved. Another major group of muscles involved are the shoulder muscles. So very often the patient complains of the pain in the shoulder. And characteristically, this myalgia produced to statin is not related to exercise. Patient may not have aggravation of the pain due to exercise. Instead, patient may have an aggravation of the pain due to certain specific food substances. Very often it is spicy or cold food substances. They aggravate the myalgia produced due to statin. And when you go for the investigation, the creatinine kinase is just marginally increased at the range of 170 to 200 in IUSH. And these patients would not be relieved with the classical conventional analgesic treatment. And vitamin D also doesn't help much in such patients. And when they come to Ayurvedic practitioners, naturally they would be in a quite significant distress. And most of the times the patients are misdiagnosed because that statin and the issues are not really recognized by many and they are misdiagnosed. I consider this as one of the variety of the Amavata, statin-induced Ama, and my treatment would be Kaishora, Mrutyunjaya, Kaishora Guru, Mrutyunjaya Amrarista. Wherever possible, I would be preferring to stop statin dosage unless it is absolutely necessary. Only a few of the patients will really require statins, and there is always a over prescription of the statins. And the percentage incidence of this is quite huge, though I may not have very objective incidences of these myalgia conditions. But what I have seen is in Indian conditions among our patients, a large number of patients are of this category. They are the drug-induced category of myopathy. And in such conditions, there may not be any other objective signs. The next stage of involvement of the statins, those who are taking statin for quite a long period, like 6 months or a year or so, they tend to develop myositis. And there, the patient would have a generalized pain almost throughout the body. It may not be only in the thick muscles, and there could be mild tenderness over the muscles also, and there could be mild atrophy of the thick muscles. The muscles bulk could be reduced. And in such conditions, the creatinine kinase level would be 200 to 300 intra-units, and I consider this as a beginning of the Dhatugata. And my treatment in such conditions will be Chandraprabha, Ekangavira and Ashwagandharista. And if we have selective this kind of treatment, patient would be really improving. And in a patient of myositis induced with that statin myopathy, a treatment like Svedana or maybe massage, they would worsen the condition. So local massages are not to be done as such. Then rhabdomyolysis, just it's only contextual. The incidence of rhabdomyolysis is very rare over statin, and most of these they would occur within 2 to 3 days of starting statin, and hence chances of getting such a patient in our clinic will be very few. So I have rarely seen a patient who has developed that acute rhabdomyolysis. Theoretically, it's a condition where the patient would have severe acute pain, and there will be very dark urine. Even there could be renal damage, and the CK levels will be very high. And it's an acute emergency. That condition would be an emergency. And most of the times, the patient, of course, the incidence is very rare. It's claimed to be more than or less than 1 in 10,000 patients, so that such a severe complication occurs. And most of the times, that patient would be already knowing, it's very evident that it's the statin-induced pathology, and the person would not be prescribed statin. So that patients with the rhabdomyolysis continuing the statin and coming to an Ayurvedic practitioner would be lesser. Anyway, from the point of view of those conditions who come with the vague pain in the muscles and in the limbs, statin-induced pathology is one of the major category of the patients whom we see, and a correct identification gives you a significant gratifying results. Kaishora Kukulu Mrityunjaya Amritari style in such conditions would be quite useful and very significantly beneficial in such conditions. Then another condition, similarly, a misleading condition often is a fibromyalgia. Again, fibromyalgia is a very vague word, and it's considered as defined as a chronic disorder of unknown etiology, characterized by widespread pain and tenderness, and most of the times there is no organic signs. It's only the pain processing. The central nervous system perceiving the pain is the real cause, and there will be sleep disturbance, fatigue, and so on. So most of the times the patients are identified as psychological distress conditions, and you may find some links which suggest about the involvement of the psyche as such. Very often they are considered as psychologically induced or depression conditions as such. Many of the patients are prescribed the antidepressants regularly in such conditions. And of course, again, a huge category of patients who end up in Ayurvedic clinics. From an Ayurvedic textual point of view, I consider this as a variant of Rasapradoshaja Roga. Rasapradoshaja Roga, the clinical symptoms are, it's a pain, local pain, as well as a general symptoms like Ashraddha, Aruchi, Asyavirasya, Hrilasa, Gaurava, etc., which are vague symptoms as such, and Nasho Agni, there will be Agni Nasha. Agni Mandya is one of the major clinical signs. Now, characteristically, the fibromyalgia can present with various characteristic clinical symptoms, and they could be quite wide varying. The important are the muscle pain, where the wider muscles, like the thoracic muscles or maybe the muscles in the back, they are more frequently involved, where the patient would have pain in the muscles, that could be fatigue, twitches, and the patient would have also the other symptoms like chronic headache, sleep disorder, and so on. Such patients, if you go on asking the symptoms, they will spend hours together complaining about the pain or symptoms, and it's always like pain everywhere. They say that pain is everywhere, and they will have some mild gastrointestinal tract symptoms. Often there could be some urinary symptoms and dysmenorrhea-like symptoms, and most of the times the physicians will be confused as such. It's not only the physicians being confused, the average physician confused. It's like the patients are, even physicians with well-versed and excellent experience also, they tend to get confused. An accurate diagnosis of fibromyalgia also is very difficult. Evidence-based diagnosis is quite difficult, and the standard protocol is anti-polymer antibody assay, which is I have never done in any of my patients. I make a clinical diagnosis, and even otherwise to get such investigation, it will be quite difficult, quite expensive. Incidence of fibromyalgia is also quite high globally. Throughout the world, it's quite huge, and many areas, particularly in India, the incidence is around 0.65% of the total population. So you will have a good number of patients coming to the clinic with these symptoms. Of course, the incidence is more in the Western countries with these symptoms, like it's almost around 6% plus in USA. Now, I have quoted one of the statements from a very popular comprehensive review article, where it said like, despite this progress, the typical patient with fibromyalgia has seen an average of 15 physicians, and it shows the importance of that, because none of the patients would be getting some relief with the usual treatment, so they tend to move from one doctor to the other, and hence usually when they meet that average of 15 physicians, there would be at least one or two Ayurvedic doctors too, so quite a good opportunity for Ayurvedic practitioners, and has had the condition for approximately 5 years before receiving a correct diagnosis. So making a correct diagnosis of fibromyalgia also requires lots of experience, and it's misleading. More than 50% of the cases are misdiagnosed, and many patients undergo unnecessary surgery or endure costly treatments that provide little benefit. Now, this sentence is not my sentence. This sentence I have shown you the reference of that sentence also from a renowned peer-reviewed journal and a very comprehensive review article. Now, clinical identification of this fibromyalgia is mainly by the chronicity, vague symptoms and absence of clinical signs. When you do not have any objective clinical signs as such, but the patient would have vague symptoms of pain and you can really feel the distress of the patient, diagnosis of fibromyalgia can be made out. And my prescription in such condition would be Smritasagarasa, Chandraprabha or Ekangavira. Chandraprabha is in those patients who are relatively weak and emaciated, underweight patients. Ekangavira Rasa is in overweight patients and relatively stout patients, Stula or Krishna. Ashwagandha Arista is the other prescription which is there. And one of my observation is massage, Pindasveda, they will worsen the condition. Many of the times what happens is a patient goes to some Ayurvedic doctor and one of the common treatment which we Ayurvedic doctors describe would be some massage, Sveda or so on, Bhashva Sveda, Pindasveda, etc. And they too aggravate the conditions and that's also one of the helpful feature to make the diagnosis as such. That's about one set of the myopathy. Then as such, to deal with that myopathy and the group of myopathy, because I have said that it's a very complex issue, just to refer about the complexity, I am just giving you some idea about the real varieties of the myopathies. I will not deal with all of these because many of them, they are not common in the clinical practice and either virtually there is not much of a benefit by making these accurate diagnoses. Anyway, from the academic point of view, the myopathies could be either hereditary, where it could be congenital myopathies, muscular dystrophies. We will try to discuss somewhat about muscular dystrophies because that's one category of the patients whom we see. Myotonia also is another of the condition which we will discuss about. Now, whether myotonia has to be considered as a myopathy or neuromuscular disorder is another of the controversy. I will try to deal with myotonia under the neuromuscular pathology, the head as such, later part of it. Metabolic myopathies also are one of the conditions, very rare. Mitochondrial myopathies, to make out these different diagnoses also is quite difficult. But in general, hereditary myopathies would have a poor prognosis. And virtually, the treatment, any of the treatment we give might not be beneficial. So if I identify any patient as myopathy, hereditary myopathy, any of these category of hereditary myopathy, usually I try to avoid the patient or at least we will explain the prognosis to the patient very clearly. Among the acquired myopathies, these are the areas where definitely our Ayurvedic treatment would be beneficial. Among the acquired myopathies, inflammatory myopathies are the ones I'll try to deal with to a certain extent about that. Infectious myopathies is a sort of inflammatory where you'll have even the Myositis and endocrine myopathies and drug-induced and toxic myopathies. These are the areas forte for Ayurvedic practitioners. Secondary metabolic myopathies are again difficult to be treated as such. Now, another category of categorization of myopathies is immune-based myopathies. Immune-based myopathies where there would be some immunological factors, either autoimmune or other immune pathologies which produce myopathies. They could be either polymyositis, dermatomyositis, or necrotizing myopathy, which is having a very rapid course as such comparatively. Another very misleading area is paraneoplastic syndrome. Paraneoplastic syndrome is again a group of set of symptoms which are produced in case of malignancy. The malignancy could be anywhere in the body, but the patient may have a symptom otherwise, which is often misleading. And then you will have lots of other named syndromes. Most of these names are virtually from the academic point of view. So we will not waste much of the time on this academic issue. From the clinical point of view, the important would be the only those conditions which you can manage, and from our point of view, what we can do. Elaborate investigations to make out these diagnoses, which may even involve the muscle biopsies, are done quite frequently. But from my point of view, all such investigations are really not the real worth of it, worth of the cost and the trouble involved by the patient. I rarely suggest any of such rigorous intervening investigations. But important is, if we can identify the causes for the myopathies clinically by having a thorough clinical history, these groups of myopathies which are produced due to toxic conditions, consumption of the drugs or alcohol, etc., or endocrine myopathies or inflammatory myopathies, these can be treated with our treatment somewhat better than other contemporary systems. Whereas other conditions, they are difficult to be treated. That's in brief about that. Now, among the conditions which we can really have many times, which are misled by the people or by the physicians, are a thyroid myopathy. Patients who are on hypothyroid conditions or even patients with thyrotoxicity often develop myopathy. And the patients who may be, and very interesting is the thyroxine drug which is often prescribed and regularly prescribed. And you have a large number of patients now coming with the prescription of thyroxine regularly. That doesn't really resolve the myopathy symptoms. The patient's otherwise metabolic functions may improve, but the myopathy symptoms may not be relieved with a simple thyroxine supplement, but thyroxine supplement may have to be continued. That's all the important issue. Then the other thyroid myopathies could be either it could be hypokalemic pathology. That could be one of the common, one of the frequent complication of a hyperthyroidism would be acute hypokalemia, where the potassium level would be reduced suddenly, and hence the patient may have weakness of the muscles, which is rare, but it can be misleading, and administration of potassium itself would be a sufficient treatment. And then, of course, myasthenia gravis, we will be dealing with that in somewhat greater detail later. Accompanied the thyroid pathology also is well known. And thyroid eye disease also is a sort of myopathy where the patient would have a difficulty in focusing of the eyes, but that comes under the ophthalmic regime, so we will not deal with much as it. But once I diagnose a patient as a thyroid myopathy, my prescription would be Arogyavardhini Kumariyasava, and if the patient is on thyroxine or antithyroid drugs, they are continued. I will not discontinue because maintenance of the thyroid functions as normal is important. And along with that, when we administer Arogyavardhini and Kumariyasava, the myopathy symptoms, they usually respond somewhat better, and most of the patients would be able to have a comfortable living, and though it may not be completely cured. Then another set of the myopathies where we can produce some change. So I have selected only those conditions where we can produce some change depending upon my clinical experience. I don't mean to say that other conditions are impossible to be treated, but with my clinical experience and among the patients whom I have seen, another category of the patients whom we treat in somewhat significant number is dermatomyositis. And these dermatomyositis conditions also are certain conditions where most of the times the patient will be visiting many doctors and then they end up in an Ayurvedic clinic. The misleading feature in case of the dermatomyositis is the underlying pathology. There could be lots of underlying pathologies which can induce a dermatomyositis. So a thorough clinical examination is important. And a typical presentation of the dermatomyositis will be there will be irritation of the skin, hyperpigmentation of the skin, and you will see that typical lesions almost throughout the body or in the exposed area of the body. Along with that, the pain in the muscles, and even the muscles pain can be so severe that the movement could be restricted, or in due course of time, it can result in some contractures even. The important is once a patient of dermatomyositis comes in, it's important to rule out any of the malignancies, underlying malignancies. Malignancies could be either breast, lung, ovary, colon, stomach, or lymphomas. Those which are induced due to malignancies, virtually you cannot have any specific line of the treatment. Even after treating the malignancies, these dermatomyositis symptoms may persist and the outcome would be very poor. Whereas a myopathy, dermatomyositis produced due to autoimmune disorders like systemic sclerosis or mixed connective tissue disorders, they are somewhat better to be treated, and probably Ayurvedic treatment has a better edge than the otherwise. So a patient with malignancies, if it comes to me, I would suggest the patient to undergo the chemotherapy or whatever the standard protocol of the malignancy treatment. I may not take much interest in treating that dermatomyositis unless it is absolutely necessary, because the outcome will be poor. But if a patient comes under this category of systemic sclerosis, definitely yes, we have certain approach which would be definitely beneficial than the contemporary treatment. The presentation of dermatomyositis, once you look at these lesions, I think it will be comparatively easy to identify. very typical lesions, scattered reddish eruptions, which have some bands-like structures in between. There will be always some gap of normal tissue in between satellites of these lesions. That's a very characteristic feature. And these lesions could be quite prominent where the skin is stretched, like around the orbits, around the joints. These are the areas where the lesions are very prominently seen. So that's one of the type of myopathies, dermatomyositis we see. My prescription in case of the dermatomyositis, particularly autoimmune conditions, would be Kaishwara Gugulu Mrityunjaya Amtarishta or Agni Chikitsa and Ksharavasti. I consider this as the Amamata, one of the varieties of the Amamata, same with treatment. The Amamata, it is also a variety of the Amamata from our point of view, and my treatment will be the same, and the results are beneficial. Another sort of the myopathy which we come across is patients with hypersteroidism, where the patients are administered steroids for some other underlying pathology. Either there could be some steroid dependent condition, and many times the steroids are absolutely essential and inevitable. We cannot, in some conditions we can taper and stop, and in some conditions it may not be possible to stop that. The hypersteroidism signs are often described as moon face, buffalo hump, and caricature-like features. And the symptoms could be seen throughout the body, and comparatively it's easy to identify the patients of hypersteroidism at basic facial expression, typical appearance of the bust as such, where the thorax and the abdomen, they tend to be very prominent, whereas the limbs, they become thinner. So it's often said like a caricature-like feature, like as students we draw the picture of our teachers. Big round for the head and big round for the abdomen and two small lines for the limbs. That kind of a feature is seen, and of course there will be other metabolic pathologies even. Whenever a patient of that category comes in, the question comes in like whether steroid can be withdrawn or not. There are some conditions where withdrawal of the steroids is never possible, like a patient with the nephrotic syndrome, or very severe sort of the skin disorders. Like it may not be possible to withdraw pemphigus like conditions. It may not be possible to withdraw steroids completely. There we may have to continue the steroids. Wherever it is possible, we try to think of withdrawing the steroids. So I cannot say like we give a universal formula like whether the steroids should be withdrawn or not. Even if it is not possible to withdraw the steroids, if we administer Punarna Mandura, Arogyavardhini and Kumari Asava, I consider this as a Kapha Dashotha and or Kapha Pitta Dashotha, and with that the patients may have some benefits as such. So that's another category of the myopathies. Now next group of conditions which we refer to. So when I say these myopathies, I again say that the discussion which we had is not a complete list of academic list of myopathies. It's not an academic discussion. I have just given you a glimpse of the patients whom I have treated in somewhat significant number and shared my clinical experience. There are a huge lots of other issues which we have not really touched with from the academic point of view. The next category of the conditions which we deal with would be the muscular dystrophies, atrophies, etc. These again are simply, they are not a specific diagnosis. This is only a description of the clinical condition. When there is a real reduction of the bulk, you call it as atrophy. The bulk is not much altered, but the functions are altered. That's called as a dystrophies. Again, I am not going to that detailed academic discussion as such. If you read the textbooks, the dystrophy chapter, muscle dystrophy chapter is a quite huge chapter. Dystrophy is a huge category of diseases, and the clinical classification also is quite detailed. I am not going to all the details as such. So from the practical clinical point of view, the majority of those dystrophy patients whom we see are of the Duchenne's muscular dystrophy, and from they are the other category, a huge category. And I just try to deal with because these are some patients whom we see quite regularly. Then another category of patients whom we see are either limb girdle muscular dystrophies or Becker muscular dystrophies. They are commonly seen. The other category of dystrophies are either rarely seen And of course, spinal muscular categories is another category which we often see clinically. Other categories of the atrophies are either rarely seen or virtually there is no curative treatment. Of course, in all conditions there is no curative treatment, but certain changes can be made out to a certain extent. Duchenne's muscular atrophy is comparatively more common, and the common clinical sign is the Gower sign, where a child would not be able to raise up from the lying down condition, and the muscle is bulky, particularly and very commonly, very frequently, it's the calf muscles which are involved quite frequently, and appearance of the calf muscles are very classical. Virtually there will be no pain, and the weakness also initially might not be observed in other activities. The initial observation will be only when the child attempts to get up from the lying down posture, it may not be able to get up straight. But it's always a progressive condition, and then the outcome will be comparatively poor. Patients of Duchenne's muscular atrophy, the expected life period is shorter. Earlier the clinical symptoms, poorer the prognosis. Some of the patients may develop the symptoms in the later age period, and they may survive for a longer duration. And virtually there is no curative treatment in this condition. As far as I know, there is no curative treatment, and the treatment will be to make the patient feel better. From that point of view, the current norms of physiotherapy, exercises, or maybe the supports, external supports like maybe splints, shoes, and so on. You have lots of other instruments. They are quite beneficial, and they can make the patient's life more comfortable. As far as the medicines prescribed, I usually prescribe Ekangvira and Ashwagandha, considering this as a Mamsa Dhatu Kshaya as such, though the bulk is increased. And I don't say that there will be a huge benefit, but many of the patients may feel somewhat better comfortable, and virtually there is no treatment anywhere. So patients going for any costly treatment also is of not much of use. So better advice to the patient is go for regular physiotherapy, or wherever feasible, think of those external supports. The other limb-girdle syndrome patients, where the patients may have atrophy, these are the conditions where the muscles will be atrophied. And characteristically, the muscles would be so much atrophied that you will be able to see the bony prominence. The physical features also are altered, and this also is a condition where the patient will be progressively emaciated, and virtually I don't see any curative treatment. I have not seen any curative treatment, but the practical, we may give some supportive treatment as such. Congenital muscular dystrophies also could be having different presentations. Again, I will not go into all the details of this, but I just give a summary of the clinical presentations. Either it could be seen as a weakness of the muscle, or it could be a hyperextensibility of the joints, as you see over here, the joints being having an increased range of movements than the usual, or even there could be the visible abnormalities like the position of the legs. These are the classical groups of signs seen as such. In general, life expectancy of the muscular dystrophy patient, in general, all put together, Duchenne's as well as all the muscular dystrophy conditions together, as per the statistics, again, the large number of statistics as a publication, is the maximum would be at age of around 40 years. Very few of the patients would be surviving beyond 40 years as such, and the report says that patients who have born before 1970, they have comparatively a shorter life period, whereas patients who are born after 1970, they have comparatively better survival period, because it's claimed that the knowledge of genetics and premarital genetic counseling, etc., has benefited such patients. Again, I will not go into that issue as such, but in general, as such, the expectancy is lesser, and hence there is no definite curative treatment for such conditions, and usual my treatment will be Ekangvira Ashwagandha, or if the patient's emaciation is very huge, then I may prescribe Abrakavasma, Tapyadi, Godanti, Ayurveda, usually, as in case of any other Dhatu Kshayajanya Vyadhi. Then another category of the patients whom we see would be a focal muscular atrophy. So whatever we have discussed till now are the muscular dystrophies sitting on the whole body. But you will have a good number of patients where the muscles of a certain region of the body would be atrophied, and they are again misleading conditions. As you see, either it could be the shoulder muscles or it could be the muscle, thinner groups of the muscles which involved are the forearm conditions. And in these conditions, to make a diagnosis of muscular atrophy is quite difficult, because most of the times there could be some underlying neurological pathology, either a damage to the nerve or maybe a compression of the nerve. So a thorough investigation would be necessary. Like if there is a significant compression of the cervical nerve root, there could be atrophy of any of the arm muscles, and in such conditions where there is a mechanical compression of the nerves, virtually medical treatment cannot help. Surgical treatment, whether it can help or not, would be a case-specific condition. In certain conditions, surgical treatment may help or may not help at all. But in those conditions where there is a compression of the nerves, compartmental syndrome-like conditions, medical treatment, trying with the medical treatment may not benefit the patient. Surgical treatment may or may not benefit the patient, and which we have to decide based upon the patient's specific condition. A thorough investigation may be necessary. But if all that nerve compressions are completely ruled out and it's a pure muscular atrophy where surgical treatment is of no use, then only we will have to give our treatment. And usually I prescribe Ekangavira Ashwagandha with the Rajayapana Basti, a Brahmana Bastis, and I don't say that they can be cured. No condition can be cured completely, but at least patients may be benefited to a certain extent. That's one of the conditions. So in general, all such conditions, I would be considering either as the Mamsakshaya conditions, where you will have Akshaglanihi, Gandasri, Shushkata, Sandhi, one group of those conditions which are producing Mamsakshaya, or they also may be diagnosed as a Kalaya Khanja, where the person would be Kampade Gamanarambhe. The person would not be able to move, be steady in the prognosis, in the movement as such. And the patient would have a Mukta Sandhibandhanam. The joint would not be able to sustain the load, and that condition is the Kalaya Khanja. So all groups of atrophies, all that large number of categories of the patient with all that complex names, I would consider either as a Mamsakshaya or the Kalaya Khanja. And the summary of the treatment would be, in general, prognosis is poor. Ekangavira Ashwagandha Gavasmatapyadi, these are the usual prescriptions. Rajayapana in very specific conditions as such. And more than any of the medical treatment, the approach of physiotherapy, external supports, etc., they would be really useful to the patient and worth of all the trouble. Now, next set of the conditions which we will deal with would be myositis, the inflammatory pathologies as such. Myositis again is a very broad term which suggests about inflammation of the muscles. Causes are not specified. Again, a large number of conditions. These are all misleading. The total spectrum of the diseases are misleading. And the basic categorization could be viral, like HIV. I have given just example. It could be either way. Myositis, where there could be a pus formation, as we call as Lyme's disease. Comparatively, the incidence of Lyme's disease in our coastal area is lesser, but it's common in somewhere in the central areas of India, or maybe in the hill area. They are common. It's somewhat endemic pathology. Then polymyositis is another condition, though not very common. It can occur quite frequently. Autoimmune myositis is another of the condition where the patients would end up in Ayurvedic treatment, Ayurvedic hospitals quite frequently. Many infective disorders like chikungunya, dengue, etc., where the patient also can have myositis as such. Collagen tissue disorders are the other category as such. Among them, those patients who end up in Ayurvedic treatment quite frequently would be either collagen tissue disorders or autoimmune myositis are those conditions which end up there. The other conditions, either they may have, they require some, because the course is somewhat acute, rarely you get such category of patients in Ayurvedic practice as such. Now, among the collagen tissue disorders, the identification would be, because there is a multiple involvement, a huge general systemic involvement will be there. Clinical symptoms also could be of fever, arthralgia, which often looks like having some other febrile disease or the diagnosis often becomes misleading. Symptoms involved also could be due to different areas, like it could be ischemia of the extremities, it could be dysphagia if the muscles are involving the swallowing are affected. A gastroesophageal reflux also could be the symptom due to the involvement of the muscles there, and even it could be present with the cardiac symptoms, and even contracture of joints could occur. So the basic issue is making the diagnosis of that collagen tissue disorder would be difficult. A spectrum of investigations which would be useful would be antinuclear antigens, C-reactive protein, HLA antibodies. These are the standard protocol of the investigations to make up the diagnosis of collagen tissue disorder, or rarely biopsy also may be required. So again, it is something like fibromyalgia where patient would be visiting many doctors, and somewhere in the cycle, we Ayurvedic doctors should be involved in the middle as such. So outcome would be comparatively poor. I consider this as a prabhuta amavata, and in all that amavata, the clinical symptoms will be of a vague symptoms involving multiple organs like angamardaha, aruchihi, krishna, alasya, gaurava, or even shunatangana. There could be swelling of the joints even. And in all these conditions, again, I will not go into further finer categorization of these collagen tissue disorders and their detail as such, which is generally not necessary. When I say this, I am not doing injustice to the academic issues. Academically, of course, all these are important. But from the practitioner's point of view, that detail of the investigations are not necessary. And the usual treatment will be Kaishara Gokulu, Mrityunjaya, Manjishtatipata, and Agni Chikitsa as such, or Ksharabasti. And once the patient has somewhat improved the Agni Chikitsa and Ksharabasti, if the patient tends to develop recurrence of the symptoms, which is quite common with the collagen tissue disorders, the patient may be relieved once, but the patient may tend to have recurrences in the due course of time. Virechana is quite beneficial. This is how we treat that. Clinical symptoms of these myositis, particularly myomyositis, would be there is not involvement of the skin as well as the muscles. There would be thicker swelling of the muscles. Very characteristically, onset is sudden, short course as such. Clinical symptoms will be sudden pain developing in the muscles along with the fever, and there could be even conjunctival infiltration, which is also quite common. A red conjunctivitis. Muscles would be swollen, and at times there could be pus also in the muscles. When we see from the clinical point of view, a large number of patients may present with the psoas abscess. So important in myomyositis would be identification of the condition in the beginning, and the treatment would be, it's somewhat a medical emergency. If the patient has developed pus, naturally you need to drain out that pus, and prevention would be rest, and rarely the patients may respond to only Ayurvedic treatment. You may require some antibiotic support as such. That's about one of the categories. Rare conditions, myomyositis is not a very frequent condition. Hardly I have seen one or two patients till now. And in that condition, antibiotics would be necessary, and drainage is quite crucial. Once the muscle has a pus, as abscess has occurred, drainage is crucial. If you do not drain, then the patient would not be relieved, and it's not a simple treatment which can be carried on in a OPD level clinical practice. Another group of the conditions which we deal with would be the polymyositis, and it's also a very vague word. Polymyositis is where multiple muscles are involved and the patient is presented with the signs of inflammation in the muscles as such, and often it's associated with the same dermatomyositis or the malignancy, which I have just referred to earlier also. And they are categorized into the conventional 6 categories. Among them, the ones which I have suggested with that green color, primary idiopathic polymyositis or dermatomyositis, they respond to our treatment somewhat better, whereas all the other 4 categories, they virtually do not respond to our treatment. So these patients virtually they are not to be treated from my point of view, as I try to avoid such patients in practice, whereas the other modern conventional treatment, contemporary treatment gives somewhat better relief in these categories than what we can do. Whereas idiopathic polymyositis, where the exact causes are not known, none of the investigations prove any specific pathology. In that condition, our treatment will be somewhat beneficial as such. But these patients, the difficulty is in workout. You have to have a very detailed workout and then make the diagnosis. Then the next of the category of, I consider these patients as particularly the collagen tissue disorders as either Raktaja or Mamsaja Dhatugata Jara, where irrespective of whether it is infective or otherwise, all infective polymyositis, my diagnosis would be a Dhatugata Jara, Raktaja or Mamsaja. And characteristically, the clinical symptoms will be Pindikodrashanam, Sista, Mutra Prishada, and Pralapaha Pitika. Pitika, the eruptions which you see over the skin, as well as the Pindikodrashana, and there could be even a hematemesis. The vascular pathologies resulting in the bleeding also would be a characteristic feature. And Ushma Antardaha Vikshepaha, there will be febrile condition. At the same time, the patient may have a toxicity. That's the Antardaha. My prescription would be again Kesharogulumuthinjam because in the Dhatugata Jara also it is the same treatment. And as I said, drainage is the one treatment. Dashangalepa in the initial phases also can help in resolution of the symptoms if the patient comes to you in the initial stages as such. Then another variant of myositis is myositis ossificans, where the muscles become inflamed and they become calcified and they produce a pseudo bone-like pathologies. Virtually there is no curative treatment anywhere in the world, but patients will be suffering for the lifelong conditions. Severity of the clinical symptoms will be depending upon which of the muscles are involved. Characteristically, there would be hardening of the muscle body, and the pain is not a characteristic feature because the muscle body is hardened. The range of movements will be reduced. There could be a structural deformity. The curvatures, different curvatures would occur in different organs of the body. As a result of that, the patient would have a difficulty in the carrying of the life, as well as when, like as you see in this patient, when the thorax is altered, shape of the thorax is altered, the ventilation is affected, patient may have a respiratory complaint, and so on. So in all such conditions, there is virtually no curative treatment. Prognosis is extremely poor. Whatever we can do would be depending upon the symptoms to make the patient feel better. To a certain extent we can do. So I may not be able to suggest a generalized treatment in that condition, but rarely we may come across such patients of myositis ossificans. Now, another set of the clinical symptoms which we see related to the muscles is muscle cramps, and very common. And muscle cramps also are simply the symptoms which we see in the clinical condition, where characteristically they are defined as a sudden development of the pain in a group of muscles. Causes are many, and the commonest causes which we see usually would be a overstraining, like when you walk rigorously after a few hours, or maybe suddenly without this warming up when you go for some exercises, that can produce the spasm of the muscles. That's Atichankramanath. These are described in the text also. These are the practical conditions important. When you have done a very rigorous exercise, or like walking or running, etc., then there could be Pindikodrasthana. Or it also can be one of the important features which are described in Ayurvedic is Vata Varcho Apravartanam. If the patient has a Purisha the Vega Vidharana, it can result in the Pindikodrasthana spasm. Now, none of the medical textbooks in the contemporary science describe this. Like if you suppress the urge for defecation, you will develop the cramp in the legs. These are not mentioned in any of the contemporary textbooks. But every person would have experience of that who had constipation. I think you will agree with me. Like it's not only the patients who say, everyone would be experiencing, like if you have a gastrointestinal tract abnormality and maybe a constipation, these clinical symptoms like muscle cramps, vague pain in the muscles are observed quite frequently. Next of the conditions would be next of the conditions which can be produced would be Mamsaga Jwara. Muscle cramps could occur in case of the Mamsaga Jwara, where Pindicoprasana is one of the symptoms, which I said either it could be a sign of a Anamata or it can be seen in any very febrile conditions also when there is a Mamsa involvement. Or it also can be involved as a Aushadha Vibhrama, administration of the drugs which are not appropriate. They also can produce the Pindicoprasana or muscle cramps. Muscle cramps also could be produced as a clinical symptom of Panduroga. Anemia-like conditions also can produce the symptoms of Pindicoprasana. So when a patient comes in with the muscle cramps as such, we have to consider these issues. As far as the contemporary science is considered, the common causes are the vascular insufficiencies, which we discussed separately, particularly varicosities, where there is a vascular stasis. Patients with varicosities, they need to be identified and their treatment would be somewhat different. Then the other causes like dehydration or patients with overexertion, they do not require any prolonged treatment. The treatment will be somewhat counseling, like advice about the patient, like dehydration. It could be some causes for the dehydration have to be identified. If there is any specific cause for the dehydration, that needs to be treated. If not, simply advise the patient to have sufficient amount of water and electrolytes. And overexertion, again, the advice will be identify those specific activities which have produced that overexertion and then try to avoid. Of course, if there is a need to prescribe, I would be prescribing Bandya Rasayana Aushadhi like Ashwagandha and Chandraprabha. Varicose veins which develop these symptoms. My prescription will be Kaisha Gugulu Punarnamandora Manjastadikwata, which is a specific treatment for the varicosities as such. Then, if the patient has anemia and then the symptoms have occurred, the usual treatment for Pandu, Chandraprabha, Punarnamandura, Draksharista is the usual treatment, and once the anemia condition improves, the cramps will improve. There is no need of any specific treatment for the cramps as such. Then, if the patient is febrile, then Mrityunjaya Kaishara Gugulu, which is the usual prescription for the Jwara, is the prescription there also. And once the patient has a cramp, the better advice would be not to massage or rub the area. If the patient keeps calm, quiet, and try to relax the muscle, the pain will be relieved somewhat early. Most of the times, the errors which the people will do would be once they develop the cramps, they try to stretch out, they try to rub the area with lots of other liniments, etc. They will prolong the pain. Whereas if you develop a cramp, my advice is just lie down for about 5 to 10 minutes and just gradually relax the muscle. The pain will be off within a short period. So it's a general treatment for general suggestion for all the cramps as such. But still, that's one of the common condition. Of course, Sandhi Shaitilya or the muscle cramps also could be produced as a result of improper Shodhana. Now, it's from our own point of view, patients who are given Vamana or Virechana, if they are not following all our advices properly, either it could be about related to the exercises. Charaka has suggested about Rasat Shobha, like traveling after the Shodhana or during the Shodhana, or it could be, it's not only about the traveling or movement, even dietary factors also, if they are not followed, contractions, spasms, and even cramps could occur as a complication of the Shodhana, which occur quite frequently, and if these are not followed properly, there is a possibility of a bad name to our treatment. So when we give Shodhana, Vamana or Virechana to any of the patients, ensuring that the patient follows these restrictions properly is our responsibility. Otherwise, you may have a bad name to the system as such. Then the next category of the patient muscle pathologies which we described would be the vascular pathologies of the muscle. My way of classification of these diseases is not seen in any of the textbooks, but from the clinical point of view, I have tried to present in the clinically useful method as well. Now, peripheral vascular disorders, whether they have to be considered under the disease of the muscle or not, the controversial issue. I would say one category of the peripheral vascular disorders have to be categorized under the muscles, and then there is another category of the peripheral vascular disorders which need to be considered under the vascular diseases separately. Incidence of the peripheral vascular diseases is increasing very rapidly, and particularly more in the older age. Once the patient crosses the age of 60 or 70, when a patient complains with the pain in the muscles, particularly a pain which is aggravated by exercise, you have to be very careful and the patient may have a vascular pathology. Incidents of that vascular disorders are very frequent who have a abnormal lipid profile, a lipotoxicity, and which may produce various organ pathologies, kidney, heart, etc. So patients will be more bothered about the kidney, heart as such a skeletal muscle symptoms. They are usually missed by either physicians or maybe the patient also initially might not give much importance. Or what happens with a good number of patients would be they would have some specific consultation for kidney and heart diseases, but for weight pain in the muscles they complain Ayurvedic doctor. This category of patients also are quite frequent, and that's the problem there. Now, as far as the conventional or academic issues are concerned, once there is a ischemia of the skeletal muscle, before you have all those classical clinical signs of the ischemia, the classical clinical signs of the ischemia like a reduced pulse or absent pulse, skin changes, atrophy of the muscles, etc. These are the later development which we consider as a vascular diseases as such. But before those symptoms occur, the initial stages which can continue for quite a long period in old age patients with atherosclerosis. Whereas in patients with Berger's disease or other thrombosis-like conditions, as the symptoms occur suddenly, you may not have this phase of clinical presentation where the patient may have a muscular pathology. So most of the times it occurs in the patients in the old age, diabetic patients, etc., where the ischemia is a gradual progressive lesion. You will see the clinical signs of the myopathies or muscular pain as such. Causes could be initially, now as the ischemia occurs, initially it's oxidative stress, then there could be some mild inflammation, or even there could be an abnormality of the mitochondrial functions. Before the muscle has developed a myopathy, the person may have a vague muscle ischemia. Now the clinical presentation of these conditions are typically a vague pain. Initially it may not be very severe pain, it's a vague pain. Often the patient describes it as some aching pain, and it tends to occur from when the patient starts moving from a resting condition. So as the patient takes rest, there will be relief. The moment he starts moving, then the patient may feel the pain. After a few steps, there will be some improvement. But when the patient walks more after a certain distance, when the muscle is exercised more beyond the limit, then again the patient would have pain in the muscles, and the pain in the muscles will be always related to the amount of the stress on the muscle. So on some day, like when the patient walks, the pain will be in the legs. When the patient does some other activity with the hands, the pain will be in the muscles of the hands, and so on. So the symptoms will be shifting, right? But characteristically, the feature like a pain which is felt in the beginning of the exercise, then when a limit of exercise is crossed, development of pain. That kind of the symptom is very characteristic of the muscle ischemia. More frequently, the pain is, these symptoms are felt in the areas of the thigh, in the calf muscles. Thigh and the calf muscles are more frequently involved, though other muscles also could be involved, but most of the times patient would have either symptom in the thigh or in the calf or in both the areas, depending upon the location of the ischemia. The incidence in the thigh muscle is quite common. It's around 60% as such. When you see buttock and the upper part of the thigh, they are more frequently involved. Whereas when the patient develops the ischemia in the lower part, calf muscles, you will have all the clinical signs of the vascular disorders like pulseless and so on, and the gangrene. It can result in such conditions. So I have left out those categories where you will have a severe ischemic pathology and the ischemic complications. I am just limiting to that borderline initial phases of the ischemia where the muscular symptoms are seen. I consider this as the Vatarakta Purvarupa, where the Vatarakta Purvarupa Janu Jangoro Katyam Hasta Padanga Sandeshu Nistodaha. It's not a acute pain, but it's a Nistodaha, Spuranam, Bhedaha Gurutvam Suktirevaja. It could be a vague pain, numbness or heaviness, so on, but not a very acute pain. And Sandhi Shuruk Bhutva Bhutva Nashiti Jasakrata. A pain which is felt in the beginning of the movement and then having a relief, then again aggravation. That's exactly the word described by Charaka. The Sandhishuruk Bhutva Bhutva Nashyati. These are the typical clinical sense of Vatrakta Pururupa, the beginning of Vatrakta. And later, of course, when it becomes severe, you will have Mandalotpati, the other classical clinical signs of the ischemia would occur. Now, the treatment in that initial stages, now I am just saying about these categories only, I am not going into the vascular pathologies now, where the patient would have a gross ischemia or the atrophy of the muscles. Once the muscles have developed atrophy, then the results would be poorer. If the muscles have not developed atrophy, it's only the vague pain, not much of a tenderness in the muscles, then my prescription would be Kaishar Bukulu, Kamaduga, Manjasari Kwata and Manjasari Ksharabasti, wherever it's possible. One of the important is Svedana would worsen the condition. Very often the patient would have a habit of doing some fomentations to relieve the pain, but fomentation would be worsening the condition in that condition. Now, next set of the pathologies related to the muscle which we discuss would be a neuromuscular condition. Again, whether to controversy, I will not go into the controversy, like whether they have to be considered the muscle disorders or not. We can debate on that issue from academic point of view, but from the clinical point of view, I have considered those patients who commit the vague clinical symptoms of pain in the muscles or pain in the body and often would produce the confusion. So that's the criteria by I have included in the muscular disorders. Among them, again, though it's a neurological condition, some of them are the neurological conditions, still I would consider these among the muscles as such, in the context as such. Among such conditions, one of the typical category of the patients whom we see would be alcoholic neuropathy. Neuropathy is actually a disease of the nerves. I am discussing in the context of the muscles, so we will not go into that controversy. Anyway, alcoholic myopathy patients often would present with one of those typical clinical symptoms where the patient may have a sort of numbness, and rather it's like patient will be having feeling like something that is covering over the limbs, usually extremities, which is often described as stock and glove sensation, and a pain, and characteristically pain when the patient climbs up. And a level road patient may not have the pain, and the pain is felt over the muscles. That's the typical features, and then the tremors also are the alcoholic neuropathy conditions. And that's rather a large number of patients whom we will see of that category. And that neuropathy produced due to alcoholic conditions, my prescription would be, of course, alcohol has to be withdrawn. Whether the patient can withdraw the alcohol or not is depending upon other variable conditions. But once the patient has withdrawn the alcohol, my treatment will be Arogyavardhini Smitsagara Saraswararishta, which is a treatment to improve the Dhatugata as well as a dependency on the alcohol acid. Then another category of the patients whom we see is a general neuropathy, neuritis, where the usual prescription from the contemporary practitioners would be a multivitamin acid, vitamin deficiencies. And I don't suggest that vitamin deficiency, I don't say that vitamin deficiency is not the cause, I am not saying that. But majority of the patients, they do not require a supplementing of vitamin acid. With our treatment, the patient can have a benefit. Characteristical clinical symptom would be that patient would have a more than pain, it's a burning sensation. And of course, it may even felt as pain, but the symptoms will be inconsistent. They are neither related to exercise, and it can occur during rest or it can occur during exercise and so on. There is no specific time. All of a sudden the patient may develop the symptoms and usually lasts for a significant time period. Then patient may feel better by himself, by herself as such. Some of the patients feel better when they take rest. Some of the patients they feel better when the patient does rigorous some exercise or local massage, etc. Feel better. Again, the symptoms tend to occur. These are the usual vague clinical symptoms produced due to the peripheral neuritis or neuropathy conditions produced due to deficiencies. and distal muscles are more frequently involved. If the patient has a skin changes where the skin becomes rough or maybe cracked like, then the diagnosis is very accurate. But we are not supposed to wait till that period. I treat that patient with either Chandraprabha, Kamaduga or Ekangvira depending upon whether it's a burning sensation or the pain. If the patient complains of burning sensation, I would consider this as a Pitta Avarana, whereas if it is a inconsistent pain, it's a Vata Vikruti. So my treatment will be Kamaduga or Ekangvira, Ashwagandha is the other condition. These are all the typical clinical symptoms of Raktagata Vata, where Daha Santapa Murchaha, the burning sensation, and Shaitya Shopa Gurutva, numbness and heaviness in the area, or Suki Birvanistodaha, a pricking type of pain, are the other clinical symptoms of the peripheral neuritis. Now, other vitamin deficiency symptoms, because we have referred to that vitamin deficiency which is often described, though they are not really related to the muscle pathology, just I refer to that part also, because often in the contemporary science, it's considered as peripheral neuropathy as the sign of vitamin deficiency, and the usual is a bulk vitamin B complex is the usual prescription, which is not really necessary. A patient having a glossitis or blank, maybe a smooth surface of the tongue, anemia, along with that, if the patient has peripheral neurological symptoms, then that's typical of a pyridoxine deficiency or cobalamin deficiency. And there again, the treatment, my treatment will be along the same lines, but the prescription will be Draksha Rishta Punarnamandura, as it is a sign of Rasadhatu Dushti. Multifactorial disorders, the typical burning sensation in the foot, which is also called as burning foot syndrome, characteristically more during rest and relieved by exercise. This also is often the typical clinical presentation of a polyneuritis or sensory deficit. There could be altered sensations also. In such prescription conditions, my prescription would be Chandraprabha Ekangvira Ashwagandha as such. That's the typical feature of the Paggata Vata, where Vaivarnyam, Spuranam, Rauksham, Suktim, Chumukchimayanam. These are the typical of the Paggata Vata, which is also another variety of the neuropathy. Now, another common set of the conditions which we see is the diabetic neuropathy. Diabetic neuropathy, we can present, diabetes patients can present with a huge number of complications. It could be the vascular pathology, it could be the neurological pathology. To identify, differentiate that neuropathy from the vascular pathology is often difficult, but these images give you some clue. In a typical neuropathy, the diabetic neuropathy, the locations where the symptoms could occur would be in a very severe conditions. It could be in both extremities, both upper and lower limb. The symptoms would be more in the extreme area, the extremity, the distant most portions. Comparatively milder symptoms in the proximal area. The important is the area of the involvement would not end up sharply. You will have some zone where the symptoms are milder, and then the patient may have a normal symptoms. There could be even a sensory loss, alteration in the sensation. Pain is felt, and reflexes may be slightly diminished or absent in these conditions. Or the other way, the symptom could be only in the lower limbs, and there again you will have a zone where a relatively milder symptom. Or some of the other patients may have certain specified zones, something like a middle of the thigh, but distal areas might not be involved, or at the tip of the shoulder the pain may be present, but none of them would have any local tenderness or the other ways, the signs. The only other signs will be slightly, the sensation may be slightly reduced, and reflexes may be diminished. Usually the reflexes are diminished in these conditions. Rarely you may have patients who have a truncal neuropathies, where you will have some specific area where the patient may have the sensations, arthritic sensations over the area, and very often it may even produce some confusion with the post-herpetic neuralgia, like localized pain. So if a history of herpes is there, then you will always have some confusion. So absence of the history of herpes, and if the patient has developed some abnormal area of sensations anywhere in the body, localized area, either over the abdomen or anywhere, with a limited zone area, that would be confusing, but still that can be a presentation of diabetic neuropathy. or a diabetic neuropathy also can occur only on some portion, some area of the limbs. In the upper limb, usually the ulnar or the median area, or in the lower limb, either lateral or medial side only involved. So these are the various presentations of the diabetic neuropathy. In all that conditions, the most important is the management of the diabetes. Maintenance of the blood sugar level at the optimum level is one of the important issues. Along with that, my prescription would be Kaishara, Gugulu, Chandraprabha and Asanadi. Asanadi is a usual prescription as such. And these are the typical features which are mentioned in the Prameha Purva like Karapadayoho, Suktataho, Paridaham, Suktatacha Angeshu. These are the typical clinical signs are in case of the Prameha as such. Now, another set of the disease which we discussed, which we have referred earlier in case of myositis and muscular pathologies, is systemic sclerosis. Now, whether that has to be discussed under myositis or whether it has to be discussed under neuromuscular pathology, again, the issue is about academic discussion. So, I will try to discuss under these neurological heads only. The systemic sclerosis is a collagen tissue disorder which involves a large number of structures, and it involves blood vessels, muscles, heart, digestive system, lungs, kidneys. So the question like systemic sclerosis has to be discussed under which of these chapters? Maybe all the chapters. So I would be having some justification to refer it to in the muscular pathology. The clinical symptoms also would be of wide varying nature in systemic sclerosis, but to make it easier to remember, it's often mentioned as crest syndrome, where you have C. calcinosis, or Raynaud's phenomena, E. esophageal dysmobility, sclerodactyly, and telangiectasia. So where the vessels would be involved and the clinical symptoms would be seen. The characteristic easy identification of the scleroderma is the appearance of the skin, where the skin seems to be inelastic, some areas of hypopigmentation, and involvement of the muscles suggested by the contractures. The fingers or the joints may tend to have an altered shape. Variations could be seen. Or the appearance of the skin is very characteristic, where the skin tends to show the inelasticity as such. And these are the typical presentation of the Gambhira Vatrakta, where you will have Shavaha, Tamro, Athava Daha, Todas, Purana Pakvana. There will be the reddish color or the bluish color seen, and the pricking type of the pain, and even there could be a Chindaniva Charati under Vakri Kuruvanshebekbana. There would be Vakrikaran, the joints they tend to become curved and deformities tend to occur, and at the end it may result in Khanjam, Pangumba, Sharire, Sarotascharana. There could be a visible deformity of the gait when the patient's condition would be severe. Prognosis is unpredictable in these conditions. Systemic sclerosis, the prognosis is unpredictable. The one important is the patient may seem to have a very steady course, but there could be a sudden worsening. Once the patient has a pulmonary symptom in a systemic sclerosis, multiple sclerosis, the condition will be, prognosis will be extremely poor. As long as the patient has any pulmonary symptom like cough, dyspnea, you can say that the patient is steady. But the most difficult problem in this condition would be you cannot predict when the patient develops these symptoms. Once the patient develops the pulmonary hypertension, I always consider it as a red flag sign where the outcome would be poor. Now, if the patient has not developed that pulmonary signs and the respiratory system is clear, then my prescription would be Kaishora, Arogyavardhini, Manjishra, and Virechana. Of course, the other conventional management like immunosuppressant drugs or maybe steroids which are prescribed from the contemporary system, they would definitely have some upper edge over what we can do with our treatment. So I don't say that our treatment would be definitely better as such. Now, because we have referred about the sclerosis, the other variant of the sclerosis is the multiple sclerosis. It's also, multiple sclerosis is usually considered under the neurological diseases, but it also has a muscle involvement. So the clinical symptoms would be of multiple areas involved. Most commonly, it's the visual symptoms which are involved. So patient may have nystagmus, optic neuritis, diplopia. Visual symptoms are the usual clinical symptoms. And the other symptoms could be the vague symptoms like some areas of legs paralysis, typically in the legs temporary, or bladder symptom like micturition or retention of the urine, difficulty in micturition, etc., impaired sexual functions. Even mental symptoms also can occur. Depression, epileptic seizures also can occur. These are the very common clinical symptoms in multiple sclerosis. But characteristically, in a multiple sclerosis condition, majority of the patients, the clinical symptom would be having one episode, and then there would be a spontaneous seeming to be resolution, and then there will be another episode and another resolution, and so on. So depending upon the number of attacks, the prognosis would be predicted. Gradually, as the attacks increase in number, the symptoms they tend to persist. There will be more and more complications occurring. So first attack, usually majority of the patient would be recovering spontaneously. Then there would be repeated attacks which make the patient worsen as such. That's the usual course as such. And the usual diagnosis criteria also is about the attacks. The first attack and then consequent attacks. Developing the clinical symptoms is the usual diagnostic criteria to make the diagnosis of the sclerosis. Evidences of depositions over the brain and demyelination. Areas of demyelination in the brain or in the nerve tissue are the classical signs which you see under radiological investigation. CT scan makes the diagnosis. The usual clinical course, once you have made that, the clinical course would be either it's a relapsing and remitting. As I said, it's in the most common. 70% of the patient would develop one episode and then a relief, then again another episode. This is the usual characteristic feature. Or a good number of patients may have a secondary progressive, in the sense the first episode the patient would have a relief, then another relapse, and so on, and entering into a progressive progressive. A primary progressive, that's once the symptom develop and then continuing to be there, they are in lesser number. It's only in 10% of the patients that they would have that kind of a category. And progressive with relapses or benign multiple sclerosis, they are under the relatively minor issues. Majority of the patients would have either relapsing remitting or secondary progressive course. Prognosis as such in poor, and as I said, the primary treatment would be somewhat either immunosuppressants or glucocorticoids. They are the usual standard protocol of the treatment which are prescribed. And our treatment, usually I use it as an adjuvant treatment. I don't try to withdraw those treatments because the prognosis is poor. But when our treatment is given as an adjuvant treatment, my prescription would be Ekangura Ashwagandha Abhrakabhasma Tarpyali, because these are the typical symptoms of Akshep Apatanaka which are seen in the textbooks. Radhayapan Basti also is the other prescriptions as such which is prescribed. Then the next of the condition which we refer to would be the myasthenia gravis. Again, a relatively rare condition, and difficult to diagnose and usually misdiagnosis. The clinical symptoms of myasthenia gravis also are big. Initially, it is a fatigue, and the fatigue will be particularly involving the ocular and orbital muscles. Patient would have a drooping of the eyelids, or occasionally the vision may be somewhat impaired after some exercise. Smaller muscles are involved. Smaller muscles like the fingers, they are involved more than the thicker muscles. Limb weakness is comparatively rare. Very rarely there could be bulbar palsy where the patient may have a difficulty in swallowing. The real pathology is there is an abnormality of acetylcholine metabolism, and as a result of that the muscles would have a paralysis. Confirmation from our conventional point of view would be identifying that ACH resistant antigen, which is a very elaborated investigational technique which may not be very frequently done as such. But triggering factors are the other clinical features which are quite important. Triggering features could be warm weather, surgery or immunization, emotional stress, etc. So the patient often give you a history like, otherwise they may feel normal. Whenever there is some other triggering factor like a surgery, immunization or a stress or so on, then again they may feel better. These are the one of the important issues. A large number of drugs could also be the triggering factors. So many times these number of drugs which can produce these precipitate the symptoms. I am not saying producing, precipitating the symptoms could be antibiotics, good number of antibiotics, psychoactive drugs like chlorpromazine, diazepam, etc. They tend to trigger the symptoms as such. High dose of prednisolone also can trigger the symptoms. The characteristic appearance is the same, like where the eye would be drooping, visions tend to be blocked, that eye movements also may be slightly affected, hence diplopia could be the clinical symptom. And this is exactly which is mentioned in our text as a akshnoh glanihi. There will be a difficulty of focusing with the eyes, and ayasa, debility, fatigue of the eyes are the clinical symptoms which are produced due to the mamsakshaya. I consider this as a mamsakshaya only. The prognosis, of course, with our Ayurvedic treatment alone, the prognosis is comparatively poor, whereas these cholinergic drugs which are prescribed regularly, they are always having a better prognosis and they are necessary. If the patient is on such drugs, I would not stop those drugs. I would be continuing those drugs as such. Along with that, we may give our treatment. There is a problem with the system. Anyway, the cholinergic drugs should not be stopped as such. There is no specific curative treatment. The benefit which we get with our medicine will be very marginal. My prescription would be usually Smritisagarasa, Ekangvira and Anutailanasya or Daryapanavasti. I don't say that this is a standard protocol of the treatment. Then another set of the diseases, maybe the last one which we discussed, would be the dystonia. Again, dystonia is a very vague word which suggests about an abnormal tone of the muscles and ending up in various forms of the uncontrolled movements. Categorized, these are standard categorization like infantile, childhood, juvenile and adult dystonia based upon the onset of the age, or it also could be categorized as based upon the clinical presentation as a focal, segmental, multifocal, generalized or hemidystonia. The words suggesting about the location, like focal is where there is a single part of the body, segmental is one segment of the nerves could be involved, multifocal. Now these are exactly described in the same manner in Ayurvedic text when the Apatanaka is described. Apatanaka can present with the different presentations as described in Sushruta. Dandapatanaka, where you will have the multifocal, generalized, where the person would be standing erect and the whole body would be rigid, or it could be Dhanustambhaka, where there would be a flexion deformity limited to some area, focal, it could be neck or other areas which are involved, or it could be a Angule Gulfajano, a specific areas of the body could be involved and there could be a spasm of the muscles, or it could be a generalized one where the whole body could be flexed as such, which is the Antarayama. Vistabdakshaha, Stabdahanahu, these are all the different varieties of Apatanaka mentioned in Sushruta, or even it could be a Bahirayama, where the patient would have the contraction of the extensor muscles and hence the whole body is flexed backwards. Or it also could be named with the different names as such depending upon the location of the areas, like are the presentations in the present day situation when torticollis, lateral collis or anticollis or retrocollis depending upon the position which is adopted after the abnormality, that's the Bahirayama, Antarayama, etc., or the focal where some areas are involved. Now, the important is that there would be a huge number of names which are used and it could be misleading words which are used. I don't say that these words are useless, but all these words like stereotypy, echinacea, chorea, myoclonus, tic and dystonia, these are all the variants of the same. Depending on the extent of the pathology and maybe a type of the pathology, these different names are used. But I would just not go into the detail of each of these issues, we'll minimize those details. From the clinical point of view, a patient presenting with this kind of dystonia, one of the important history which you have to take is whether the patient is on any of these medicines. Very commonly, psychoactive drugs like haloperidol or phenytoin, valproic acid, etc. carbamazepine, which are usually treated in the psychiatric disorders, or lithium. These are the drugs which tend to produce the dystonia quite frequently. And if you take a detailed history, you can make out the causes. And the number of such patients are quite high. And the treatment depends upon whether it's possible to withdraw those drugs or not. That's the important issue. In addition to those drugs, the other causes could be you will have lots of other diseases which can present with the dystonia. Dystonia could be a symptom of many other diseases, Parkinson's, Huntington's, Wilson's, etc. So a very detailed assessment is necessary. If you identify these patients with either drug-dependent conditions or maybe a primary dystonia where there are no other basic organic pathology, my treatment will be Smith-Sagarasa, Ekakvira, Saraswarista, Tailadhara and Nasya. Considering this as a sign of the Dhatukshaya Janya Vata Prakopa, and I will be treating the patients under these lines. But the most important issue, you have to identify the underlying pathology. Only when the underlying pathology is seen, we can make out the diagnosis as such. With this, we will conclude for today's session, and the conclusion is simple. Clinical presentation of musculoskeletal diseases are complex. A thorough clinical examination can reduce the need of many interventional investigations. Selective conditions and can be very effectively managed with the Ayurvedic approach. With this, thank you.